HCSM. في ناس كتير الفترة اللي فاتت بقى لها فترة كده بتسمع عن ال HCSM وهيتعمل فيه ايه وهنعمل ايه وهنشتغل ازاي ومين ال HCSM وبيشتغل ليه ومعمول لمين مين اللي يحضر ومين ما يحضرش. I guess you will have a problem because of the translation, right? Okay. So is it fine with everyone if I speak English? Yes? Sure. في حد عايز ابقى unilingual عربي بس؟ لا؟ Is it fine with everyone if I speak على طول English? Sure. Okay. Then we'll be speaking English. So I will start my presentation with this idea, this picture. This is actually the best dessert in the world. This is my grandma, Ali. Is everyone familiar with Ali? Okay, Ali is a typical Egyptian traditional dessert, and it's one of the best types of desserts in the world, to be honest. And this is the best for me. Honestly, I love the taste of this. I love the feeling of it. I love just the whole story of Ali. What happens actually is that Ali is very interesting, very well done, very tasty, but the problem is that it's not very well presented. We are all, as dentists, we have some of us just typically similar to Ali. In which way? In the way that this is how we function, this is how we look, this is how we communicate, this is how we work in the bigger picture, in the bigger system. This is how we work, just exactly like Ali. We taste well, we taste wonderful, we know very well how the job is done, but we don't look right for this job. On the contrary, this is the most expensive crepe sold in the world. This is sold in Paris, in the streets of France, and this plate costs around 43 euros. For this plate, it's just crepe with some strawberries. And this plate is special and quite expensive because of a very simple fact. Because this is how the plate looks like, where it's served, and this is how the waiters look like, in a way. And this is how the kitchen looks like. On the other side, Grandma sounds just this vibrating voice, and she cooks Ali in this small, narrow, dark kitchen, and she presents Ali or serves Ali in just this typical plate. And this is why Ali is different from this trip. This is why Ali is just eaten till the half of the plate, and sometimes you make through the rest of the plate, while this expensive crepe plate is quite expensive and is ordered only in advance, and you get to order it and just sit and just receive the whole thing together. Just indulge yourself with the experience, live through the thing. This is us. These are dentists everywhere. There are dentists who are quite good, who do really how the work is done, but at the same problem, they are not presented right. You don't know how to communicate with the patients. They don't know how to communicate with other dentists. They don't have skills like referral. They don't have skills like advertising to themselves. They lack the skills of being everything around a clinician, just a dentist who treats the teeth. This is the problem. This is what happens with a system like ours that teaches you very well how to be a dentist, okay? We give you lots of requirements, we give you work to be done, we give you papers to read, but we lack giving you all of the other characteristics of a dentist. This elegancy of dentists, this communication of dentists, this power to talk about dentistry. These things are things that are lacking. So let's reflect a little bit on this. In this picture here, you see the traditional education that used to happen everywhere in the world. Someone standing there, holding a microphone or just talking in front of students, and the students would be listening and trying to get notes out of this, and getting as much academic knowledge out of this, and then they start applying these knowledge in sections and on patients and this way. What happened is that teachers, us, we became boring. We became compared to technology, compared to this small, teeny tiny device called mobile with Facebook on it, compared to those nice games on iPads, on iPods, we became quite boring. We became a source of information just similar to a blank, boring book. And this is the problem. This is what happened to the education of dentistry and many other education systems. This is what happened to our education systems. That the students sitting there are enjoying more coffee and those small, tiny devices that they use to access Facebook and internet more than they are enjoying the teaching process. And what happened is that with the students losing interest, they lost interest in getting the knowledge itself. That's why we are proposing this now. That's why we are trying to think out of the box and proposing a different way of education, which is a very big word. Education, not teaching. And education in the matter of everything related to education. So let us reflect more. Formal education will make you a living, yes. You will all, after graduating from the faculty of dentistry, you will be dentists, okay? But you will be just a living. You will be just another dentist, another clinician. You are in many ways similar to this cute, nice robot that they are working on in Japan that knows very well how to diagnose class 1 caries, how to diagnose medicine, lesions in the mouth, and knows very well how to treat these things. Because he has the database in his system, and he knows how to deal with the disease as a disease. And now we lost this essence of being doctors. We became just clinicians. So formal education will make you a living, but self-education will make you a fortune. Self-education in the matters of us trying to teach ourselves new things, trying to teach ourselves how to talk, how to communicate, how to handle problems, how to deal with other dentists, how to deal with patients, how to deal with health systems, okay? Going from this, I will tell you that education is what survives when what has been learned is forgotten, or has been forgotten. And this is the biggest difference. Education is totally different from the learning or teaching process. Education is this thing that you live through, that you feel, this experience that you go through, that makes you remember certain things. It's this exact, similar Omani and crepe story. It's this thing. Because after today, you'll go all out and then remember, okay, so we don't want to be Omani. We want to be a good crepe that looks good. And this is what matters, is that in 5, 10, 15 years, every single person holds this piece of information, this value in his mind. So this is what matters, is that you get this, and not only get this, but remember it. Because we dentists have a problem in our system. It's that in some years, we lose the essence of dentistry. We just become clinicians who do amalgams very well, who know how to extract, who know how to move teeth, who know how to remove some calculus. But we lose the fact that we are dentists, that we need to talk about prevention, that we need to talk more about patient education, that we need more communication with patients. We lose this all of it because we get indulged in the circle of life. So let's shift a little bit paradigms. Let me give you some perspective. I am now proposing the HCSM, which is the healthcare simulation model. What is a healthcare and what is a simulation model? Let me start just simple. A healthcare system is all of this system that exists in any country. In here, in Sudan, in the United States, Malaysia, in India. This system that deals with patients, this whole institution that deals with patients, including personnel, you, tools and facilities like this faculty, private and public, so clinics, private clinics, yes, public, which is healthcare systems like insurance and healthcare systems like research institutes, all of this is included in this word, healthcare systems. So the first part of this is that I'm talking about healthcare systems, okay? This is one. Two, what is a simulation model? A simulation model is a way of informal education to students and learners. In which way? In the way that they, and this is the most important piece of information, that they teach what they need to learn. So if you need to learn patient-dentist communication, then I would give you a topic, which is patient-dentist communication, and under certain supervision and trainings, you should train this to other students, to other delegates, what we call delegates in models. And this way, she will be the best person to teach patient-dentist communication. And at the same time, the best person to practice himself patient-dentist communication. Let me give you another example. To let you all think of how hospitals are managed. Okay? Some of you here, in 10 years, will be going up the stairs to be the hospital manager, the general manager of the hospital. Okay? Some of you here, in 30 years, will be the Minister of Health. Okay? She will be the Minister of Health of Malaysia, you will be the Minister of Health of Germany, and he will be the Minister of Health of Egypt. And what happened is that those people, they don't usually get a specific training to be this. They just practice certain things, they develop in a certain way, so they become ministers of health. They become hospital managers. And this is what we are trying to do now. It's trying to teach you, this young, at this age, how to deal with this whole system. How to be a hospital manager. How to be a healthcare representative, like the Minister of Health. How to be someone who deals with other dentists. How to gain this value of referral and counter-referral. How to understand how systems work. Because we are different. In Egypt we have this massive, deep problem of having nothing organized. The healthcare system is divided into public and private. Do the public parts of the system deal or integrate or even contact the private ones? No. This is a problem. So we have private clinics. Tomorrow she'll be a graduate, and then she'll go out of the faculty, go to the ministry. Okay, I need a license to be to have my own clinic. Okay, please have your license. She'll go out in the market and open up a clinic, which is just another clinic, like any other clinic, and starts treating patients. In 50 years, she'll be dead, and another person comes. And this person just opens up another clinic and starts doing it his way. And this is wrong, because we are healthcare. We have certain requirements to give this service. Among the requirements would be equality. What is equality? Do you know that in healthcare, it's well known worldwide that the poorest and the person who has millions should get the same, at least, diagnosis? We don't get the same diagnosis. Diagnosis, basically. Okay, so the ones who cannot afford might sometimes not afford the facilities, so yes, it might be sometimes different to treat them. Might sometimes not afford the tools or the instruments that we use. Yes, okay, this exists. But they should get the same diagnosis, basically, everywhere. This is agreed upon. So what happens is that we don't have any integration between those systems. We have something that's called segmentation, fragmentation, and stratification. I will not talk about these. These will be explained in the model. So this is now how I'm trying to get you to know what is the healthcare system simulation model, okay?